Hello everyone, I'll be reading the next part for today. I'll be reading on accident prevention, falls, and healthcare, and I'll be also be reading on burns and scalds, and resin identification, choking, poisoning, cuts, abrasions, and fire. Alright, so falls. A fall is a sudden uncontrollable descent from a higher to a lower level, with or without injury. Resulting falls make up most of the accidents that occurs in care facilities. It can be caused by any unsafe environment, loss of abilities, diseases, and medications. Problems resulting from falls range from minor bruises to fractures and life-threatening injuries. A fracture is a broken bone. Falls are particularly common among the elderly. Older people are often more seriously injured by falls because their bones are more fragile. Uh, Nursing assistants should especially alert to a risk of falls. All falls must be reported to supervisors such as a nurse. These factors increase the risk of falls. Clutter, throw rugs, um, exposed electrical cords, slippery or wet floors, uneven floors or stairs, poor lighting, call lights that are out of reach or not promptly answered. Personal conditions can risk the risk of falls, including medications, loss of vision, gait, walking, or balance problems, weakness or paralysis, and disorientation. Disorientation means confusion about a person, place, and time. Clear all to prevent falls. Here are some guidelines. Clear all walkways, cluttered trash, throw rugs and cords. All rugs should have a non-slip backing, have resins, and wear non-skid sturdy shoes. Make sure the shoelaces are tied. Residents should not wear clothing that is too long or drags on the floor. It keeps items that are used often close to the residents, including call lights. Answer call lights right away. Immediately clean spills on the floor. Report loose handrails immediately. Mark uneven floors or stairs a type of contrasting color or indicate a hazard. Improve lighting where needed. Lock wheels and move footrests out of way before helping residents in and out with the wheelchairs. Lock beds with wheels before for helping a resident into out of bed when giving care. After completing care, return beds to their lowest position. Get help with moving residents. Do not assume that you can do it alone. Keep residents' walking aids such as canes, walkers within their reach. Offer help to elimination often. With elimination often, respond throughout requests for immediately. Help immediately. Think about how you feel about how to wait for help to go to the bathroom. Leave furniture in the same place as you found it. Know which residents are risk falls. Pay attention that you can give help often. If a patient starts to fall, be in a good position to support her or him. Never try to catch a falling resident. Use your body to slide her onto the floor. If you have a reverse fall, you may hurt yourself or the resident. Whenever a patient falls, must report to the nurse. Always complete an incident report even after the resident says he feels it's fine. Burn scalds. Burns can be caused by dry heat, hot iron, stove or electrical appliances, wet heat, hot water, or other liquid steam. Chemicals, cleaning products, small children or other adults lost of sensation such as from paralysis or diabetes are at risk of burns. Burns are scalds caused by hot liquid. Mhm. Scalds or burns caused by hot liquids. It could take 5 seconds or less for a serious burn to occur with a temperature of a liquid of 140 degrees Fahrenheit. Coffee, tea, or hot drinks are usually served in 160 degrees Fahrenheit to 180 degrees Fahrenheit. These temperatures can cause almost instant burns that require surgery. Preventing burns is important. Preventing burns and scalds. Always check water temperature. Always check water temperature with a water thermometer if available, or inside a risk of before using. Immediately report frayed electrical cords or appliances that look unsafe. Do not use them. Remove them from the room. Let patients know when you are about to pour or set down the hot liquid. Pour hot liquids away from the patients. Keep hot liquids and liquids away from the edges of the tables. Put lids on them. Make sure patients are sitting down before serving hot drinks. If a plate warmer or other equipment that produces a heat are used, monitor them carefully. Resident identification. Um, Patients must also be identified before giving care or serving food. Failure to identify residents can cause serious problems, even death. Facilities have different methods of identification. Some have pictures identify residents. Others have signs outside, residents outdoors. Nursing assistants must identify each resident according to the facility policy for giving any procedure or giving any care. Okay. Nursing assistants identify each resident according to the facility policy from beginning of any procedure or giving any care. They should identify residents before placing meal trays or helping them when eating. The diet card should also be checked against the patient's identifications to make sure they are matched. The patients should also be called by their name and asked to state her name if able. Along with the room number and patient's name may also be displayed outside the room and to identify who is living in that room. However, the room number should also not be used to identify the patient. For giving any care, nursing assistants must also always properly identify residents. Choking. Choking can occur when eating, drinking, or taking medication. People who are weak, ill, or unconscious can choke on their own saliva. A person's tongue could also be swollen or could obstruct the airway. To guard against choking, patients should also eat upright position as possible. Patients with swallowing problems such as dysphagia may be prescribed with special diets or thickened liquids. Thickened liquids also easier to swallow. Chapter 8 contains more information about thickened liquids. Poisoning. There are many harmful substances in facilities that also could not be swallowed. These include cleaning products, paints, medicines, toiletries, and glues. These products should also be stored or locked away from confused residents, such as with those with limited vision. Cleaning products should also not be left in the resident's room. Patients with dementia may also hide food and not spoil in closets, drawers, or other places. Nursing assistants should investigate any odors they notice. The number of areas poison control center should also be posted near all telephones. Mhm. Cuts and abrasions. Cuts and abrasions typically occur in bathroom at a facility. An abrasion is an injury the back rubs often service the skin. Sharp objects such as scissors, nail clippers, and razors should also be put away after use. Nursing assistants should also take care of transferring residents into in and out of beds, chairs, and wheelchairs. When moving patients into wheelchairs, nurse assistants should push the wheelchair forward. Wheelchairs should not be pulled from behind. When using elevators, wheelchairs should also be turned around before entering so patients are facing forward. Okay, everyone, that will be the end of this section. I will read the next section next time. So please subscribe and comment on my videos below if you like the content. Thank you everyone so much. Bye-bye now.